As the world is gearing up to commemorate the International Childhood Cancer Day, Uganda cancer cases received every year are 34,000, of which only 23.5% of these make it for proper care at Uganda Cancer Institute. In Western Uganda Regional Cancer Center, they receive 1,200 new cancer cases every year. It is noted that common cancer is the cervical cancer, infected-related, which is in women, and still common prostate cancer in men. 10% of all new cancer cases is seen in children, with a total of 6,700 admitted. The Uganda Cancer Institute said that many of the Ugandans have cancer, but these have no access to the services needed to treat them. In order to reduce the increasing cases, they are working with the Ministry of Health to ensure that care and services are enough and accessible to all Ugandans.
So the first is going to focus on what we are doing at the Mulago campus to address the challenge of cancer. And one, if you've been at the Cancer Institute Mulago, you know that we have significant numbers of patients. The Cancer Institute is currently a 149-bed hospital, and we are in the process of expanding this from 149 beds to 353 beds over the next 18 months. And the goal of this expansion is really to improve the patient spaces, but also to cater for every patient who comes to the Uganda Cancer Institute. In addition to just the bed spaces, we're also working on equipment. We have expanded our capacity to manage patients in different areas. In radiotherapy, as some of you may know, we have expanded and acquired. Currently, we have a total of 8 radiotherapy machines, which is a very, very big leap from where we were in 2016, where we had absolutely no machine. In addition, we have also started work on a nuclear medicine facility.
Regarding cancer control in the country, in the perspective of the communities and public, Dr. Alfred Jatho, public health specialist, said as the Uganda Cancer Institute, they have a department for community cancer services, majorly for cancer prevention and other education, as they strengthen the capacity of districts' health facilities and regional referral provide elements of cancer services.
As I speak, since 2016, when Uganda Cancer Institute was given a mandate by an Act of Parliament to have leadership over cancer control in the country, we increase our scope countrywide. We train at least 4 health workers in each district of Uganda to be able to provide cancer information in their respective district, to make sure that there's some element of screening taking place in their district. As I speak now, at least each health center in Uganda or a district hospital in Uganda has at least a cervical and breast cancer screening unit.
However, the Uganda Cancer Institute has also come up with the National Cancer Control Plan, which has been approved by the Ministry of Health to guide on the cancer treatment, prevention, and early detection.
And then, of course, we have also developed some guidelines which are going to help us in doing all this. And the importance of this is so that we maintain quality. It's not enough for us to kind of do things without ensuring that the population of Uganda, in as far as their cancer management or cancer activities, including early detection, and all these are being done according to international standards. That is the role of the Uganda Cancer Institute, to make sure that those standards, those tools are there.
Regarding the traditional healers on the cancer, Jackson Odiem, Executive Director of Uganda Cancer Institute, noted that cancer is not a spiritual disease and should not be regarded as such. Also, since access to the information and diagnosis in the past has been minimum, the public has to take initiative to be diagnosed.
You may say you also need the element of trust, the element of faith. All that is part and parcel of life. But we should not say that, there is only one way of handling the situation. The first thing that is needed is a diagnosis. A diagnosis is needed. And in most cases, be it the traditional healers, be it the pastors, they don't have that. So we need, in the first place, a diagnosis. And diagnosis can only be made by well-trained and a place which has the capacity to do it.